name you know and trust.
May happens to be National Stroke Awareness Month, a very important topic for all of us here in the Tennessee Valley. Our numbers tend to be higher than the national average. A great time for us to have a conversation in this morning with Scott Rowe. He is with Encompass Health. Dr. Tom Devlin, a very familiar name and face to many of our viewers. He is now the director of the CHI Memorial Neuroscience Center. Great to see you both.
Thank you.
Good to be here.
Dr. Devlin, I kind of want to kick things off with you actually, because at your encouragement, I mentioned that it's an important conversation in this part of the country. We do tend to have higher numbers than the national average, don't we?
Yes, and that's really a great place to start. I think all of our listeners need to remember that of all the medical diseases out there, stroke is the #1 cause of adult disability. It's the #1 reason why someone's in a nursing home. And around the entire world, it's the #2 cause of death for medical reasons. So there is no more important medical diagnosis than stroke. And the really exciting thing to remember is that 80% of strokes are preventable. And why is that so important? Well, it's important because of what you just mentioned. We are in the stroke belt of the United States. We have the highest incidence anywhere in the United States of strokes in counties right around Chattanooga, Tennessee.
So we'll talk about the warning signs of stroke in a minute, but when you talk about it being preventable, is one of those ways to prevent it keeping your blood pressure in check?
Absolutely. So, the blood pressure guidelines recently have changed, and in a very important way. So, a current normal blood pressure now, it used to be considered, it was originally a long time ago, 160, then 140. We now deem, the American Medical Association and the American Academy of Cardiology says a normal blood pressure is 120/80. Now, why is that important? It's important because that makes 50% of the people in the United States, adults, have some component of hypertension. And we know that if the blood pressure is not within the normal range, that's one of the highest risk factors for having a stroke as well as a heart attack. And it's also one of the easiest to control if you follow up with your primary care provider.
So, Scott, Encompass to that end is jumping right in. You factor into this conversation because so often when Chattanoogans find themselves with a stroke, they end up going to Encompass to recover. So you're trying to kind of take the bull by the horns with this new initiative relating to high blood pressure, right?
Yeah, so this is something that we're teaming up with the American Heart Association and just trying to raise awareness. Our initiative is called #CheckIt, and it's just encouraging folks in the area to have their blood pressure checked on a regular basis. Because as Dr. Devlin mentioned, almost half of American adults have high blood pressure. But what's really interesting is that 1 out of 3 don't even know that they have high blood pressure. So just raising that awareness, encouraging people to make sure that they're seeing their physician on a regular basis and addressing that high blood pressure if that's the case.
We were having this conversation over Mother's Day weekend, actually. Our mom is having a bit of an issue. Her medication has shifted, and so her blood pressure dropped over the weekend. It was quite low. And one of my brothers made the comment that I guess since COVID, the days of going into the local drugstore and using their machine that they used to have there at the pharmacy, I think those aren't really accessible as much anymore. So should people keep a blood pressure monitor at their home? And if so, do you want to make sure you get one with a good reading?
Yes, I think they're, for the most part, blood pressure cuffs are pretty well accessible from any local pharmacy or Walmart or someplace like that. But again, just regular checks with your physician are that much more important because of the fact that they're not as available in some places as they might have been in the past because of COVID.
So talk about hypertension, Dr. Devlin. That means that basically we're way too stressed out?
Well, stress is an issue, and it's been a very stressful year. And with stress comes more alcohol consumption, more eating. We have a very rich diet in salt and fatty foods and whatnot. And these are all the things that predispose. So I think, as Scott just mentioned, the key thing is monitoring, home monitoring. So buy a blood pressure cuff at the store. The best one to get is one that's an automatic one that you hit a button that says start, it automatically calculates your blood pressure and it reads it out. Get a cuff that goes on your upper arm. Follow the directions. Make sure you have the right size cuff. It'll show you how to do that. And then when you take your blood pressure, sit in a chair, wait for a minute or two before you take it. Don't take the blood pressure lying down. Sit in a chair, put your feet on the floor, don't cross your legs, sit calmly and take your blood pressure. And then track it. And for people that are concerned about this, do take it every day and write it down and bring those blood pressures to the attention of your primary care provider. So 120/80 is the number that we're shooting for. Anything consistently over 120 in the upper number or consistently over 80 in the lower number now is considered hypertensive. And it's really the trends that we're looking for. Everybody may have a single blood pressure that's high, but it's the trends over time that we're looking to gain here.
Okay, Scott, we only have a couple of minutes left. For anybody watching and maybe they have a loved one who had a stroke even a year ago, can they still benefit from recovery with Encompass?
Yes, they can. I mean, I think that's one of the things with stroke is that each individual case is unique. And so one thing to keep in mind, though, early mobilization and early rehabilitation is important after someone has a stroke, especially starting in the acute care hospital setting. But immediately after that, making sure that their loved one is receiving the most intense level of therapy. And by intense, I don't necessarily mean the activity that they're doing, but the amount of therapy that they're getting. And the American Heart Association recommends that people who have suffered a stroke receive their rehabilitation in an inpatient rehabilitation hospital, because that level does provide the most therapy, typically 3 hours of therapy or more a day of physical therapy, occupational therapy, and speech therapy.
Less than 20 seconds, but Dr. Devlin, I have to brag on you. Through your leadership, Chattanooga is ranked top in the country for our ability to help people recover and survive a stroke.
Well, it's all about a team, and the key thing is just remember the word FAST, which AHA says: facial weakness on one side of the face, arm weakness, the drift, you can't raise your arm or the arm drifts down, speech, either slurred speech or you can't get your words out. So that's FAS, and T is for time, to remind you, call 911. We have fabulous treatments for stroke these days. Face, arm, speech abnormalities, call 911. Come on in and we'll get you treated. And keep in mind, the best way to treat a stroke is not to have it. And if you have it, Encompass does an amazing job on the stroke rehab side. So thank you both.
Great to see you. Here is how you can get in touch with Scott and his team at Encompass. Great to see you both, and thanks for the information.
So much.
Thank you.
Someone was texting on their phone, not paying attention, and hit me. But I can't afford a lawyer.
Don't worry. Call the Insiders.